Hi, we have an amazing guest. I'm a big fan of this company, and please tell us your name and what you do, and then we can talk about the company itself.
Sure. I'm Dr. Alisa Niksch. I'm the senior medical director at Owlet. Owlet is an infant monitoring company. We've been around for about 12 years. And we're here to talk about sort of the devices that we have and the type of data that we collect and we can transmit for medical care for infants and children.
My first question is, I know that there's no really big market for direct-to-consumer in healthcare in the US, but you like one of the few companies that stand out. Tell us, what's the secret? How did you make it work?
You know, I think there's always a hunger for parents and families, to keep their children safe at home. There are more SIDS deaths in the U.S. per year than there are, deaths from car accidents. Everybody gets a car seat, but we don't all have monitors for our children that work. We went ahead and developed this monitor. We have now 2 on the market that are FDA-cleared. One is our over-the-counter Dream Sock, which is for healthy babies at home to detect unanticipated events or illnesses. And then we have our prescription pulse oximeter for infants who need chronic medical condition management. And that's covered by insurance, and we've gone through the process to get all of those measures in place to provide access for safe monitoring at home, whether you have a healthy baby or a baby who has medical needs.
But I believe you started as a wellness device first, then got FDA approval, right?
That's right. So we have monitored over 2 million babies. So we started really a direct-to-consumer business that evolves with a lot of parental engagement, and so our strength is really sort of our grassroots influencers and parents who have their own personal stories about our product.
Right.
And I think that simply because it's a family parent-infant relationship that we're dealing with, there is, I think, the mission-driven emotional component to why this works as a direct-to-consumer business, at the forefront.
I love it. Remind me, what are the biomarkers that the standard sock can take? So
this sensor that's embedded in the sock measures SpO₂, or oxygen level, pulse rate. There's also an accelerometer embedded, so we're monitoring motion levels, which enables us also to track sleep. The prescription device on the app has customizable alert parameters, so it's really tailored to every individual patient need, versus the over-the-counter consumer device, which has fixed parameters for alarms.
So the use case is parents put the sock on the baby, for example, for the night, and if there's something happening, something abnormal, you get a notification on your phone, or how does that work?
That's right. So the primary source of alarms, the sensor here collects that data, transmits it by low energy Bluetooth to this component, which is the base station. This, if a reading falls outside of that range, it will light up red lights and have about a 70 decibel alarm. Great to have by your bedside as a parent. The data then goes into the cloud via Wi-Fi, and then that comes down and populates the phone app that's a companion to the device with the alarm, as well as the data for what it's for, what the reading actually is. And even aside from an alert, parents can go into their app and look at their readings, continuously, real time, so they can always keep tabs on how their baby is doing, even if they're in the other room.
That's awesome. And you mentioned you've collected tons of data over these years. I assume there's some use case for AI in this game.
Yeah, so we were just talking about that earlier at my talk with our EMR integration partner, Rhapsody. We were talking about, kind of how we're able to collect very granular data. We collect SpO₂ and pulse rate data at a 1 hertz frequency. Mm-hmm. This is cleared for continuous use. So that granular data, especially accompanied by contextual clinical data, electronic health record information, claims data, parent-generated data, can really develop a registry of very, very interesting patterns that we can actually apply models to and see if we can actually apply predictive analytics for babies with certain risk factors to develop conditions in the future.
That makes a lot of sense.
Yeah.
We're here at ViVe. Any takeaways from the conference? Anything surprised you maybe?
I think like there's a big theme on sort of trust in the data, making kind of the foundation of the data inputs into an AI model, as robust as they can be, with good governance, good security around it. And that has to be sort of the foundational work, which Owlet is definitely doing right now, before we get to the exciting, AI model that we're going to apply to it. So I think it's really about uniformizing that, that data stream and making sure that when it comes from different sources, that somehow there's oversight into kind of what that looks like when the model is applied.
That's great. Well, thank you so much, Alisa.
Thank you for having me.